BCEN test prep exam Cengage. Question 1. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A. Confront the colleague directly. Option B. Report the observation to the charge nurse or manager immediately. Option C. Document the observation in the patient's chart. Option D. Call the police. The correct answer is option B. Report the observation to the charge nurse or manager immediately. Question 2. To calculate cerebral perfusion pressure, CPP, the nurse needs to know: Option A. Heart rate and blood pressure. Option B. Mean arterial pressure, MAP, and intracranial pressure, ICP. Option C. Respiratory rate and oxygen saturation. Option D. Is central venous pressure and cardiac output. The correct answer is option B. Mean arterial pressure, MAP, and intracranial pressure, ICP. Question 3. A patient leaving against medical advice, AMA, must be informed of: Option A. They cannot ever return to this hospital. Option B. Their bill will be sent to collections. Option C. The risks and potential consequences of leaving. Option D. The police will be called. The correct answer is option C. The risks and potential consequences of leaving. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which assessment finding is consistent with a flail chest? Option A. A crepitus over the sternum. Option B. Paradoxical chest wall movement. Option C. A tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Paradoxical chest wall movement. Question 5. Murphy's sign is used to assess for: Option A. Pancreatitis. Option B. Acute cholecystitis. Option C. Diverticulitis. Option D. Small bowel obstruction. The correct answer is option B. Acute cholecystitis. Question 6. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is: Option A. Obtain a urine pregnancy test. Option B. Administer pain medication. Option C. Prepare for pelvic exam only. Option D. Discharge with follow-up. The correct answer is option A. Obtain a urine pregnancy test. Question 7. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of: Option A. Acute glaucoma. Option B. Retinal detachment. Option C. Corneal abrasion. Option D. Cataract. The correct answer is option B. Retinal detachment. Question 8. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A. Atrial flutter. Option B. Prolonged QT interval. Option C. Osborne, J. wave. Option D. ST depression. The correct answer is option C. Osborne, J. wave. Are you looking for BCEN exam actual questions? Visit our website pokerexams.com to access BCEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get BCEN exam answer key today. Question 9. Hepatitis A is primarily transmitted via: Option A. Blood and body fluids. Option B. Fecal minus oral route. Option C. Sexual contact. Option D. Contaminated needles. The correct answer is option B. Fecal minus oral route. Question 10. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is: Option A. Obtain a stat chest X-ray. Option B. A needle decompression at the right second intercostal space. Option C. Administer albuterol nebulizer. Option D. Prepare for intubation. The correct answer is option B. Needle decompression at the right second intercostal space. Question 11. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A. Insert a urinary catheter immediately. Option B. Perform a retrograde urethrogram before catheter insertion. Option C. Irrigate the bladder with normal saline. Option D. Prepare for suprapubic catheter. The correct answer is option B. Perform a retrograde urethrogram before catheter insertion. Question 12. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects: Option A. Cystitis. Option B. Pyelonephritis. Option C. Nephrolithiasis. Option D. Renal artery stenosis. The correct answer is option B. Pyelonephritis. Question 13. A patient receiving intravenous nitroglycerin for chest pain develops severe headache. The nurse should: Option A. Stop the nitroglycerin infusion immediately. Option B. Administer morphine for the headache. Option C. Treat the headache and continue nitroglycerin as ordered. Option D. Switch to oral nitrates. The correct answer is option C. Treat the headache and continue nitroglycerin as ordered. Question 14. A female patient of childbearing age with abdominal pain should always be evaluated for: Option A. Ovarian cysts. Option B. Pregnancy status. Option C. Endometriosis. Option D. PID. The correct answer is option B. Pregnancy status. Question 15. Sengage minus Blakemore tube placement is used as a temporizing measure for bleeding from: Option A. Peptic ulcer. Option B. Esophageal varices. Option C. Diverticulosis. Option D. Aortoenteric fistula. The correct answer is option B. Esophageal varices. Question 16. The antidote for benzodiazepine overdose is: Option A. Naloxone. Option B. Flumazenol. Option C. N-acetylcysteine. Option D. Atropine. The correct answer is option B. Flumazenol. Question 17. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST- segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A. Left anterior descending artery. Option B. Left circumflex artery. Option C. Right coronary artery. Option D. Left main coronary artery. The correct answer is option C. Right coronary artery. Question 18. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is: Option A. Forcing oral fluids. Option B. Straining all urine. Option C. Pain management. Option D. Surgical consultation. The correct answer is option C. Pain management. Stressed about your BCEN exam? We can take BCEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. What is the priority intervention for a patient with an open fracture? Option A. Immediate surgical debridement. Option B. Apply traction. Option C. Cover the wound with a sterile saline-moistened dressing and immobilize. Option D. Administer analgesics. The correct answer is option C. Cover the wound with a sterile saline-moistened dressing and immobilize. Question 20. The golden hour for acute ischemic stroke refers to the window for: Option A. Completion of an MRI. Option B. Administration of 4 thrombolytics, TPA. Option C. Achievement of blood pressure control. Option D. Initiation of physical therapy. The correct answer is option B. Administration of 4 thrombolytics, TPA. Question 21. Which pupil finding is associated with uncal herniation? Option A. Pinpoint, non-reactive pupils. Option B. A unilaterally dilated and fixed pupil. Option C. Bilateral mid-position and fixed pupils. Option D. A constricted, sluggishly reactive pupils. The correct answer is option B. A unilaterally dilated and fixed pupil. Question 22. Fat embolism syndrome is most commonly associated with fractures of the option A, distal radius, option B, pelvis and long bones, option C, clavicle, option D, metatarsals. The correct answer is option B, pelvis and long bones. Question 23. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates option A, allergic rhinitis, option B, nasal mucosal secretions, option C, CSF leak, rhinorrhea, option D, sinus infection. The correct answer is option C, CSF leak, rhinorrhea. Question 24. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects option A, open-angle glaucoma, option B, acute angle-closure glaucoma, option C, a conjunctivitis, option D, uveitis. The correct answer is option B, acute angle-closure glaucoma. Question 25. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A, pulmonary fibrosis, option B, right ventricular failure, option C, left ventricular hypertrophy, option D, atelectasis. The correct answer is option B, right ventricular failure.